No precautions are too great. The smallest gap in protective equipment could mean death. These particular measures, though familiar, predate coronavirus. These are for Ebola.
Dealing with fear was something that I really had to get my head around and actually gain courage as a result of that.
Natalie was one of the UK health volunteers working on the front line of the 2014 Ebola outbreak in West Africa. Part of a team from King's College already on the ground in Sierra Leone when the outbreak hit, gaining skills the NHS is desperate for in these current times.
A skill that I've been able to transfer that I learned during the Ebola outbreak is, and I didn't realise I had until now, was just being able to problem solve in a crisis.
Natalie's back home working as an infection prevention nurse, finding very practical uses for her hard-earned experience.
Because I've got a knowledge of decontamination from Ebola, so I was working out how we're going to go into someone's home and test them and then decontaminate inside their home in a safe way, and setting up that process and getting all the PPE supplies sorted and kind of training people and setting up a training program.
The most infamous and deadly outbreak of Ebola was that of 2014 in West Africa, concentrated mainly around Liberia, Guinea and Sierra Leone. Ebola is a particularly lethal disease, killing around half of those it infects. During the outbreak, nearly 30,000 people were infected, killing more than 11,000 before ending in 2016. Many of those on the front line of fighting Ebola are now involved in the UK's current response to COVID, some at the very highest level. Chris Whitty, the Chief Medical Officer and the face of the UK's coronavirus response, is one of them. He was at the forefront of the UK's effort in tackling the Ebola outbreak, and the lessons learned in West Africa are being applied back here.
The most important lesson was the importance of communities. Communities absolutely need to understand how they need to behave. They need to really engage with the health professionals. They need to own the crisis. The second thing is leadership and governance must be strong, and communication is critical. We mustn't have confused messaging.
Community response, strict containment measures, mass mobilization and understanding did finally conquer the West African epidemic. Although it's still the least affected continent, coronavirus has now gripped Africa. But for countries who bore the traumatic brunt of Ebola, they are now better prepared for this new threat.
I mean, certainly the Sierra Leone response, if we use that as an example, has learned extensively from Ebola at all the different key aspects of public health management. So they're better equipped for contact tracing, for laboratory diagnosis of cases, for having adequate treatment facilities where they can isolate and safely care for people. So from the systems approach, they're in a much better state than they were going back 5-6 years ago.
For the advocates of a stronger global health cooperation, it's not just those countries that receive help that benefit. They argue that the UK's involvement abroad strengthens its own defences.
I don't think the UK is going to be able to rise to the current health challenge or other future health challenges without looking out. To look out into other situations and contribute to weak health systems in low and middle income countries. We can learn a huge amount through engaging in these lower middle income countries. We probably can take some of that learning back into the UK.
Viruses like Ebola and COVID breed fear, isolating and confining individuals. But help, engagement and kindness between nations may yet be the answer to this global crisis.